Hello, I'm Seth Brown, a lecturer in the School of Education and a program leader at the UNESCO Univoc Center at RMIT University. For this project, we are interested in your ideas about possible futures for young people around the topic of health and well-being. The COVID-19 pandemic is a public health crisis that has mostly impacted the physical health of older people and people with underlying health concerns, which is not to say that the health impacts of COVID are not also significant for a number of young people. However, the series of lockdowns that Melbourne has experienced since March 2020 have produced a range of social, economic, and policy crises that have had a particular impact on young people, most notably in terms of massive disruptions to schooling, education and training, enforced periods of social distancing and isolation from family and friends, and severe impacts to the businesses and labor markets that mostly employ young people. Around the globe, across Australia and Victoria, and in metropolitan Melbourne and Melbourne's inner north, these disruptions and crises have posed significant health and well-being challenges for different groups of young people. Between April and July, the Melbourne-based Commission for Children and Young People conducted surveys with over 640 children and young people and 170 plus staff from 70 service and support organizations on the impact of COVID-19 on children and young people. In those surveys and in other reports, young people and the service providers who work with young people reported increased uncertainty and anxiety about the present and the future, and increases in issues related to feelings of isolation and disconnection, of young people being isolated in situations and contexts that place more young people in harm's way and at risk of violence in their homes from family members or friends. For many young people, COVID-19 enters a world in which their concerns about the climate crisis and the community, business, and political inaction in relation to this crisis, to ongoing concerns about racism, sexism, and discrimination on the basis of sexuality or disability, all impact on their well-being, their sense of self, and their experience of the present and the future. At the same time, we've encountered different young people's different hopes and aspirations for a future that remains uncertain and anxiety-provoking. The challenge in this part of the forum is to engage the range of these health and well-being challenges and imagine the influences these challenges have on young people's futures and their education, training, and employment pathways, and their sense of belonging in families, neighborhoods, and communities. These are generational impacts that will likely echo for a number of years to come. What does the future hold for young people's health and well-being in Melbourne's inner north and elsewhere?